Good morning, everyone. Welcome to our EHE Regional Learning Collaborative session on community infrastructures to help end the HIV epidemic. My name is Elena Rosenberg Carlson, and I'm the EHE coordinator here at the UCLA Center for HIV Identification, Prevention, and Treatment Services, or CHIPTS. For anyone who's joining us for the first time, our purpose is to facilitate knowledge sharing and support collective action across California's 8 EHE Phase 1 counties to help accomplish our shared EHE goals. And as always, we also welcome folks from outside these 8 counties to join the sessions and learn together with us. So thank you all so much for joining this morning. In the chat, you should see an option to send a message to all panelists and attendees, or to everyone. If you haven't yet, please use that option now to introduce yourself to everyone here on the call by sharing your name, affiliation, and location. Next slide, please. So many of you are probably familiar with or even part of an HIV planning council. All of our EHE Phase 1 counties here in California have some kind of HIV planning council connected to the Ryan White Part A funds for their eligible metropolitan area or transitional grant area. These community infrastructures play a critical role in setting HIV-related service priorities for their area, and also in providing community and consumer voice in the decision-making about how funds are used for HIV-related medical and support services. But in addition to the planning councils, there are several other types of community infrastructures that have emerged across the state to help address HIV and related conditions. Today's session will feature the development, implementation, and lessons learned of 3 of these great community infrastructures. We'll begin with presentations and then move into panel discussion and open Q&A. As always, please feel free to submit questions at any time during the session using the Q&A function on your Zoom control panel. We'll use the Q&A function to collect and respond to questions throughout the session and during the live Q&A at the end. We'll also keep the chat function open in case you'd like to share comments or resources with the group at any time. I also want to note that we are recording the session and we'll post the recording and slides on our EHE Regional Response webpage within the next week. So now I'm happy to introduce Dr. Sammy Lubega, Interim Director for East Bay Getting to Zero. Thanks for joining us, Dr. Sammy.
Hi, thanks for having me. Good morning, everyone. So I'm just going to give a quick overview of East Bay Getting to Zero and our Ending the HIV Epidemic journey, how we were able to create our organization, align it with the EHE initiative, and how we've been able to involve our community members at pretty much every step along the path. So here is our mission and vision. And so for a brief background for people who don't know us as well, we are in the East Bay of the Bay Area, so just across the Bay Bridge from San Francisco. The heart of the East Bay is Oakland, which is part of the Alameda County EHE jurisdiction. But our East Bay Getting to Zero coalition actually also includes Contra Costa County, which is just to the north of us. The way that it's set up geographically is that our communities really cross between the 2 counties and sort of how they work and play and interact. And so it made sense really early on that we didn't use kind of these federal jurisdictions to mark where our impact was and where we could collaborate. So we created a coalition that involves both of our counties. Our community is also a lot different from San Francisco. It's much more diverse in terms of who's affected by HIV and includes more communities of color who have been hit hardest by transmissions, more heterosexual transmissions, and more multi-ethnic, multilingual populations. So we've really had to think broadly about how we were going to be inclusive of a lot of different folks, whereas our closest jurisdiction, San Francisco, has a little bit different of an epidemic. So we really couldn't actually model a lot of what we were doing on the way that they had set things up in a similar way.
Dr. Sammy, I'm sorry to interrupt you, but your slides aren't showing right now to the group. If you want
I'm
to go
so
ahead and
sorry.
No, that's okay. Great introduction. I just want to make sure
Yeah.
folks can see your slides.
Yeah, thank you. Okay, are you seeing them now?
Yep, looks great.
Okay, great. I apologize. So what I was showing before, this was the only slide that I really showed, was just our mission and vision of how we've been working together collaboratively. In terms of our history started a long time ago in 2011 when our leading doctor, Dr. Sophie Wong, actually put together a linkage and retention working group just involving frontline workers who were really interested in collaborating around how we were identifying new infections, how we were helping people get linked to care and to actually stay in care. And so that picture at the top is our linkage and retention working group. When we used to meet in person, it would be about 50 different people, a lot of case managers, providers, other people who are on the front lines of the work, getting together about quarterly to workshop and to kind of problem solve around issues that were coming up. So we already had a group of people who were really engaged in working together across CBOs. And it also included partners at Alameda County Health Department who were involved in HIV care. By 2017, there were a few different developments. One is that there was this new interest in HIV prevention and forming a similar working group. So that's the second group here, which I took the lead on. So we had one group focused on prevention and one group focused more on care. There's also a global initiative called Fast Track Cities that Oakland was a part of. And so then there was some interest in the mayor's office in developing community forums to really hear about how the community wanted to address the HIV epidemic on a global scale through these global metrics that had been set by Fast Track Cities. And through those community forums, it became clear that people were interested in a Getting to Zero type of coalition that existed in many other jurisdictions and other areas. And so Sophie Wong really led the charge of getting together a volunteer steering committee of community leaders who were interested in trying to figure out what that would look like. And that's our initial steering committee featured at the bottom. By 2019, the steering committee had actually identified a path forward, had applied and successfully gotten some seed funding, which allowed us to become a fiscally sponsored organization. And by the end of that year, we had actually received a Board of Supervisors commendation for being a important new entity that was going to impact our local HIV epidemic. And so I think what was unique about our structure at this point is that we were having to do this sort of outside of our public health department. We exist in a county where our clinical services and our public health department do not overlap. And so what it means is that most of our clinical services are just scattered among different nonprofit organizations, community organizations, federally qualified health centers, but none of it could really be centralized under health department. So while they partnered with us, we had to form a separate entity, actually a nonprofit entity outside of them. And we sort of charged ourselves with being the nimble arm, the people who could do things that were a little bit more creative, a little bit more on the ground than what the public health department was able to do in its traditional role. That ended up partnering nicely with the federal Ending the HIV Epidemic initiative starting in 2020. Where there was actually new funding coming into the county to do exactly what we had just formed ourselves to do, to come up with new, interesting, innovative ways to approach the epidemic and our local approach. And so we were given funding by the county health department to come up with a community-driven strategic plan for the first 5 years of our Ending the Epidemic initiative. And so that's what I'm going to share a little bit more about today. So this is essentially what our structure looks like. At our foundation, we have our steering committee, which includes just our 3 core team members, our advisory board, and our what we call the Pause Plus group, our people living with HIV group. And I'll tell you a little bit more about all of those. Our linkage network that we had since the beginning, our prevention network, and then through Ending the Epidemic, what became clear from our community members is that they wanted some extra working groups that really really focused in some of these additional areas. So in housing, community messaging, youth engagement, and then one that's Spanish language, which we call our Grupo de Charla y Activismo. Our steering committee initially was that smaller group of volunteers, but as we became more of a fiscally sponsored organization, we were able to call on our community partners, basically any community organization that had involvement of service for people living with HIV or HIV prevention work, to be a part. And it became really clear to us that because we were so decentralized, we were going to have a pretty big steering committee to represent our really diverse group. And we actually just recently did an internal survey of our steering committee to really make sure that we were reflective of the diversity of the populations we were serving. So I just wanted to share some of what we found about the makeup of our steering committee. We're really proud of how much we've been able to reflect the folks that we are serving and inclusive of folks we are serving. And so we continue to periodically check in about this and kind of think about ways that we can be more inclusive of groups who are central to our mission, but who aren't reflected well in our steering committee yet. We also have these set of core values that we use to sort of drive all of the work that we're doing, and key communities that we've identified really based on our local data. So looking at our Alameda County and Contra Costa County HIV reports, and then also having an actual workshop that we had towards the beginning, really trying to identify other lived experiences that we know really shape people's experience of HIV and vulnerability to HIV, and making sure we're thinking about how we can reach folks with those vulnerabilities, collect data around that, and really make sure that we're focusing on equity. So these are the strategic priorities that we came up with. And this is just a little bit of an overview of our strategic plan. I'm not going to go into it in detail, but just wanted to give you a sense of all the steps that it took. This was about a 1-year process of workshops and feedback sessions with various community members to figure out where we wanted to focus our activities. So I'm just going to go through and give little snapshots of the work that we're doing. Each year, we kind of come up with 2 main activities that we want to do in each area. And we try as much as we can to drive this, but also use this as a template so that when folks say, hey, we want to work with the East Bay, we want to initiate a research project with you, we already have a sense of where our communities say the need is and where we need help with interventions. So our linkage network is really focusing on improving collaborations. I've given some examples of some of the collaborative work we're working on. One of the main things we did was create an actual service directory that's online that our organizations can go in and update themselves with their information. This ended up being really important for us during the pandemic, when we all of a sudden had to pivot to doing everything online and interacting virtually, but we did end up just kind of moving all of our meetings to virtual spaces and continuing to do those collaborative workshops with community members, such as our emergency room and substance use linkage workshop. For innovative models, we really wanted to look at new innovative models of care and really focus on our HIV prevention in terms of how can we reach populations that we haven't been reaching before. And we decided to really focus on testing everywhere. This idea that people could just get an HIV test at home, they could do one at a community organization, that we were taking testing out of the clinics and into the community, which again became that much more important during COVID, when we didn't have all of our traditional testing centers open. And so these are just some of the examples of the testing programs that we harnessed and that were started to help us get testing back out into the communities in new ways. This is just another example of a pilot project that we did in collaboration with Alameda County Public Health Department, where we bought 50 bottles of Truvada, or the Public Health Department did. We distributed them to centers that we know saw particularly vulnerable populations, and then kind of tracked how we were using those bottles of PrEP to reach new patients who we thought otherwise might not be getting access to same-day PrEP in the same way. One of our other innovative models that we were hoping to get is this idea of kind of one-stop shops where queer people of color could come and get all of their needs met. And so we have a few examples of projects that we're working on, mainly a research collaboration with folks at in San Francisco to develop a van that actually outreaches particularly to areas where we know we have high rates of new diagnoses and high prevalence of HIV. Our housing working group is one that we created out of the recognition that the housing crisis in the Bay Area is really driving a lot of the disparities and equity issues that we're facing across this endemics. So we really wanted to focus a group on both housing advocacy and really optimizing housing opportunities for people living with HIV and most vulnerable to HIV. And so we were able to get kind of our housing gurus from Alameda County and Contra Costa County working together to create housing workshops and kind of housing 101 guides for our case management programs to use. And then lastly, I wanted to share a little bit about our Ehe Expansion Project. So those extra projects that we've really been able to use Ending the Epidemic to help take off. And they've all been pretty community focused projects and community facing projects. So first our people living with HIV group, which was started before Ending the Epidemic. But one of the things that's really emerged from this group is the idea that they wanted to do a big legacy project in the form of an AIDS memorial garden. So Oakland and the East Bay doesn't have an AIDS memorial space as many major metropolises do. And so this has been the work of the group, and it's actually really taking off. We just found a spot by Lake Merritt. We have a pro bono landscape architecture firm that's starting to draw up models of what it's going to look like. So we're really excited that this is actually going to be one of our biggest community facing projects that we are going to have at the end of at least this first 5 years. We've also been working hard on community messaging and how we're getting messages out about HIV in ways that are sex positive and destigmatizing and resilience focused. It's involved collaboration of all of our working groups because this is kind of the heart of what we're trying to do is new messages in new ways. I'm not going to get into this too much because I know I'm running out of time, but we also focused on COVID updates for our community, particularly people living with HIV, and created some infographics along the way just to help people better understand COVID as that started to impact our communities. And this is what some of our content has looked like in partnership with local artists. Where we have tried to kind of do some youth-facing messaging, some Spanish language messaging to really just diversify our reach. So some examples of our digital media content. And then our youth content, which has really been driven by our 2 youth interns who a year ago, they were able to create this, collaborate to create this East Bay Love campaign, which was sort of our summer campaign when we thought we were just going to be getting back out into the world when we all got our COVID vaccines and starting to do community outreach. And then this is an example of our Grupo de Charla y Activismo work and our most recent campaign for called the Loteria campaign. And it is a all Spanish language campaign focused on prevention, U=U, and testing. And it's actually featured right now on AC Transit all over the region. So to finish up just really quickly, a few major lessons that we learned. I think one is the importance of centering our work on our people living with HIV and how important that is to really keep us focused on our mission and our vision. Number 2, having a strategic plan that we really invested in. Our community said over and over that they get asked what their needs are, and then nobody ever really follows through on what they're going to do to address those needs. So we have an iterative process of every year going back to talk about what projects we've been working on to address that. sustainable funding, which I know we would all love, but it's really been key to us being able to invest not only in our core team being able to do this work, but also the many people who are involved in actually having a way to get paid for the contributions that they're making to this, rather than just volunteering. And then building collaboration. So we really made a visionary plan, and we're constantly looking for ways to collaborate with other Getting to Zero coalitions, with the state Ending the Epidemics initiative that's emerging. So we're really trying to maximize our impact and not reinvent the wheel around anything that we've been able to accomplish so far. So that was a whirlwind tour of our coalition. Thank you.
Wonderful. Well, thank you so much, Dr. Sammy. Really appreciate your presentation and all of the great work you're doing with East Bay Getting to Zero. I did want to note there was a request in the chat if you would be willing to share the Housing 101 guide if it's available. I know you have an upcoming webinar also about it. So feel free to share that in the chat. And I'll also be sending out links and resources from all of our presentations to all of our participants after the session as well. So thank you so much again, Dr. Sammy. For our participants on the line, feel free to put any questions you have for Dr. Sammy and East Bay Getting to Zero directly in the Q&A box. And we'll be sure to get to as many as we can during the live Q&A session at the end. Now I am excited to introduce our second presenter. Joining us from the End the Epidemics Coalition, we have Ryan Clary. Ryan is a nonprofit consultant who provides coalition support, project management, and assistance with strategic planning for ETE. Good morning, Ryan.
Thank you, Lena. Good morning, everyone. Thank you very much for inviting me to present today and to talk about End the Epidemics. I've looked through the participant list and I see there are many coalition members here, so please weigh in through chat or during Q&A to add to anything I have to say, hopefully not correct anything. The coalition is a statewide project of many advocates, including many participating today. So as I was preparing for the presentation, I went through some pictures and I chose this one because I thought it really captured a lot of what End the Epidemics does and who's involved. This is from a legislative briefing right before the shutdown in 2022, where the coalition went to Sacramento and presented on the epidemics and the coalition's budget request to lawmakers and their staff. So you can see a lot of coalition members here and partners, policy folks, community members and advocates, public health who participates as advisor, and medical providers. I thought this captured the group pretty well. So just to give a little bit of background, so End the Epidemics started 4 years ago in April of 2018, and it was founded as a lot of coalitions and projects are founded through a meeting. There was a meeting in Los Angeles of about 40, primarily HIV advocates, but also from STI and hepatitis C communities, to really look at how advocacy community could start urging the state to move forward on developing an End the Epidemics strategy. The discussion started really around an End the HIV Epidemic strategy in the state, and quickly, because so many advocates, including many of you here, work on issues in addition to and in conjunction with HIV and have been looking at a syndemic approach, really decided quickly to figure out how to partner and collaborate and really come up with a joint strategy, initially around HIV, hepatitis C, and STIs. Really no concerns around that, no opposition. Everybody was really excited to look at new ways of advancing advocacy strategies. The coalition has committed to centering racial justice in our work. I'll talk about that in a little bit. And then last year, we added hepatitis B, or 2 years we added hepatitis B and overdose to our priorities. And so that's why we now have a longer name than Californians mobilizing to end HIV, hepatitis C, and STIs, but we now say viral hepatitis and overdose. We have about 150 organizational members around the state. We also have about 100 individual advocates on our listserv and who participate in our coalition calls. We are partnered with the California HIV/AIDS Policy Research Centers, who I'm sure most of you are familiar with, the think tank research wing of HIV policy work. Actually, CHIRP was part of the original founding of the group and sponsored early activities of the coalition. The initial goal, which we worked on throughout 2018, as you will remember, that was an election year, gubernatorial election year, and it was really to urge the candidates at the time, and then when Governor Newsom became governor, then candidate Newsom became governor, to really urge the new governor to take the lead in convening a state level, community-driven, integrated task force to develop a strategic approach to ending the epidemic. So really at first wanting to sort of put it on the state to develop this plan and then have community be involved in implementation. Because that sort of governor-led project didn't happen in the first few years, of course, now the state has been working on a strategic plan. The coalition really looked at, well, we can't wait until that happens. We have immediate needs to address. And so the coalition really started looking at developing and moving forward a budget, legislative, administrative strategy and grassroots advocacy, how to have people most impacted by the epidemics be involved in urging their elected representatives, administrative officials to take the lead on these issues and provide the funding leadership. So this is a policy coalition. The group is not working on programmatic issues or education, testing. Whether that happens down the line based on what the coalition decides to prioritize, that may happen. But this is really a public policy advocacy grassroots organizing statewide coalition. I wanted to share our mission. I think hopefully it captures really well our racial justice centering and focus, and really trying to show that we have a syndemic approach. We are looking at all of these epidemics and how they interact with one another and how so many communities are impacted by it. And this is our syndemic slide that we try to cover whenever we talk about end the epidemics. Of course, this is an approach that so many people and organizations and coalitions and health departments are moving toward. We think this is what has made us unique as a statewide policy coalition. We haven't found a lot of other states having advocacy coalitions with this approach, but more and more, of course, this is how people are moving, and it's really what I described about how so many of these epidemics are interrelated. So many impacted communities are the same and impacted by one or more of these epidemics. And really, it's best not to address these in silos anymore, but how do we address them collectively and as a so I was asked to sort of talk about our structure and my role a little bit in this structure. So I would say, as is also the case with a lot of coalitions, we built a coalition and then we have developed the sort of infrastructure, structure, and communications and decision-making over time based on issues that have come up and based on capacity that has extended to be able to do that kind of internal work. As you know, this is a coalition of folks outside of myself, who is paid as a consultant to work on this project. Everyone else, has their own full-time jobs, and so their work with this coalition is in addition to this. And so having the time and flexible schedule and capacity to do the work, to really sit down and come up with structure and decision making, has been limited. But the coalition does know it's important and has been working on it. So again, develop over time, really a work in progress, trying to be very flexible, because in public policy and advocacy, things change depending on economic environment, elections, other priorities. So we do have to be flexible. We do have a strategic plan that guides our work, but it is flexible, like I said, and not so rigid that if a activity isn't done in a particular year, that's seen as a problem, as long as it's shown that we have to prioritize and move to other areas. We do structure our work through committees, which we have found to be effective and productive. And it also provides an opportunity for coalition members to really focus in one or more areas where they prefer to focus and to provide their skills and expertise. So we have an organizing committee, and all of these committees, including organizing, are open to anyone in the coalition. So at any time, a member can join the committee or working group. They don't have to apply or meet a certain set of expectations. And we have found that to be a good way to have as many members as possible participating in the work. So the organizing committee, of course, oversees the work, makes sure that the activities in the strategic plan are happening. Really importantly, making sure that the working groups are communicating, that we're identifying where there's activities or discussions happening in one or more working group that really should be brought together for collaboration and co-discussion and partnership. We have a policy and advocacy committee, so that's the group that develops with input from the whole coalition, develops our budget strategies, priorities, legislative strategies, and moves forward those strategies through advocacy campaigns. We have a community engagement working group that's really the grassroots organizing group that works to develop activities and projects for individuals to be a part of this process, particularly those most impacted by the epidemics, to develop legislative meeting campaigns, social media campaigns, action alerts, ways for people to really have their voices heard from a personal level. We have a communications working group that obviously works on our social media, developed our website, issues press releases, and a racial justice working group that came together a few weeks after the murder of George Floyd to really look at, are we doing all we can within our work to make sure that racial justice and equity and health equity and justice are at the center of our work. I'll say, since I know a lot of you are thinking about developing structures within projects and working groups and coalitions that you might be working on, these are all different. They're all based on what members of the committees want to do in terms of regular meetings, how to organize their work. So some of these groups have regular recurring monthly meetings. Some of them are more project-based and come together based on projects and don't have those monthly meetings. We thought that kind of organizational structure would work best. Each working group has 2 co-chairs. It's in our infrastructure plan that at least 50% must be BIPOC individuals. We do have a paid consultant who is me. And I think I've learned over my 30 years of this work that the coalitions that are the most effective are where there can be someone who is paid to do some of this work. When you have a coalition where it's all volunteer and people are adding it onto their existing work plan, it's hard to have that person or that leader or coordinator, I should say, who can really oversee coordination of the project, look for areas that need some work, do that project management, grant management, major project management that keeps the coalition going. Our communications happen through monthly coalition calls. We have a Google group, we have social media, and we now have a website, which is great for us to now have. We do evaluation surveys twice per year. That's also mandated in one of the grants we have, just to get feedback from everybody. How's it going? Do you feel like your voice is heard? As well as their take on infrastructure. And we do have, in addition to individuals from organizations participating in leadership positions and support positions as for the coalition, and there is in-kind support, financial, grants management, and otherwise. So I'm probably running a little low on time. We've had a really strong public policy impact, I believe. You've probably heard about in recent years, there's been increased funding for hepatitis C, HIV, STIs, harm reduction services, and this year for hepatitis B, which is really great. This year was disappointing that our requests for a lot of the epidemics was not approved. We did get some sort of historic initial funding for hepatitis B, which was great, and a significant amount of funding for syphilis and congenital syphilis, excuse me, but not for our HIV, hepatitis C, and harm reduction services. So some disappointment there, but we have been successful in getting some ongoing funding for all of these areas. Like I said, we partner with public health at the state and also the county levels for our administrative work, and then some key pieces of legislation that we've been involved in. We've had an impact in grassroots strategy. We make sure the coalition members have input to our priorities and try the best we can to make sure that is meaningful input. We had a consensus statement in 2018 where organizations, almost 150, signed on to ask the governor, Governor Newsom, when taking office, to prioritize this. We've had town hall meetings right up until the shutdown where we've organized conversations in different local areas to try to get input for the coalition's priorities. We've had legislative meeting strategies, both in person and virtual. We've had opportunities for members to just gather socially through Zoom to meet one another and share strategies. And we do have an upcoming training through the Midwest Academy. That information will be coming out soon around that, where we will provide opportunities for a group of coalition members through an application process to get some really in-depth grassroots training. And then there's the impact on racial justice, where we really ensure that we have strong BIPOC leadership among all committees and working groups, that we're taking the time to examine all of our strategies through a racial justice lens, and we have organized several racial justice trainings. I will say that more work could be done in this area. We try to really make sure through the organizing committee that we're constantly having those conversations, but there can always be, and there should be, more work done to make sure that this focus is really hit. Just briefly, some challenges, lessons learned. So we've really learned that this has been an effective way to do advocacy, that sort of disease-specific advocates working together has not only have there been no real concerns around it, but has really worked well and has shown impact in policy. Resources and capacity are critical to look at. We did that through strategic planning. If an idea came forward through strategic planning where there were not resources or capacity, they went into a parking lot instead of trying to take on more than we can do. As is the case again for coalitions, it's really a small group of people who have taken on the majority of the work, and I think feel a lot of pressure to take on more. And that's something that just really has to be looked at. No judgment around that. Everybody's doing their other work, but I think there are folks in the coalition who've really taken a strong leadership role who are really maybe struggle a little bit with making sure they have the capacity to do so. We're looking at sustainability, like all organizations and coalitions, to diversify our funding. We're lucky to have some grant funding, but really want to make sustainability something that we're confident with. And then we're looking now around onboarding new members. We have so many people joining who don't come in with the context or the history and are just sort of thrown into the coalition, come on monthly calls, but they need the context to understand the history, where they fit in, what their role is, how they contribute, and we're working on ways to improve that through some onboarding trainings and materials. And finally, I'll just put up some of our ways that you can be involved or get more information. Excited to have a new website. Elena helped a lot with that, so check us out. We have a lot of our priority documents and other key background information on there. You can join the listserv and the coalition through our website, and we do have a social media presence. And with that, thank you, and I look forward to Q&A.
Great. Well, thank you so much, Ryan. I know folks are interested in some of these links and contact information that you shared, and also Dr. Sammy shared. I will be sharing the slides with everyone and relevant contact information and links after the session. So don't worry if you're not able to write everything down right now. But Ryan, thank you so much for sharing the great work and infrastructure of the ETE Coalition. And now I'm excited to introduce our final presentation Our presenters for this presentation are coming to us from the Los Angeles County Department of Public Health EHE Steering Committee, and they include Julie Tolentino, who is the Ending the HIV Epidemic Program Manager for the LA County Department of Public Health, as well as two EHE Steering Committee members, Matt Brush and Ty Gaffney-Smith. Thank you all so much for joining us.
Thank you so much, Elena. Hi, everyone. I will go ahead and pull up my slides. If Ryan, you don't mind stopping sharing your screen. Perfect. All right. Okay. All right, so hi everybody. Thanks Elena for the introduction. Again, I'm Julie Tolentino, the program manager with the Division of HIV and STD programs at the Department of Public Health. And today I will be going over our Ending the HIV Epidemic Steering Committee that has been instrumental in really guiding our Ending the HIV Epidemic efforts. So when Ending the HIV Epidemic was launched, we really wanted to be responsive to our federal partners who were encouraging us to think about lifting up new voices, bringing in new perspectives, identifying non-traditional HIV partners to really help shepherd our Ending the HIV Epidemic efforts here locally in Los Angeles County and among jurisdictions across the nation. So that really was our purpose of wanting to create an Ending the HIV Epidemic Steering Committee. We had talked about what size committee would make sense to really help us inform our work, and we decided on approximately 15 to 20 committee members would be a good size in terms of the committee and garnering input from a diverse set of voices and folks. We developed an application. It was online via SurveyMonkey, and we released it and opened it up for a 2-week application period. And during that time, we received over 85 applications, and we distributed the SurveyMonkey application via our traditional channels. So through our local Ryan White Planning Council listserv, through our Ending the HIV Epidemic listserv, and then also we're intentional in reaching out to key stakeholders in the HIV arena, other general public health listservs, to really get the word out that this was an opportunity for folks to join. In the application, we included questions regarding your general contact information. We included demographics, which were optional for applicants to answer. We asked about subject matter expertise across different sectors, contributions made to HIV-related strategies, and asked questions related to populations with specific lived experience or populations that applicants probably had experience serving or working with. In terms of the review and selection process, we developed a standardized scoring tool for candidate analysis, and we created an application review team that consisted of our Division of HIV and STD program staff. We looped in the Department of Public Health leadership and engaged staff from our local Ryan White Planning Council, the Commission on HIV, to participate in reviewing the applications and sit on the selection committee. We also grouped the applications based on affiliation, and so we had a cohort of applicants that were representing organizations. We had community member applications, we had physician applications, and so we really grouped them so that the reviewer would have a sense of all of the folks that were applying that were in this in that particular affiliation. We also had a 2-phase review process, and so we had the team review the applications. We had meetings to discuss all of the applicants, and then from there we had a second review process where we looped in leadership from both the Division of HIV and STD programs and the Public Health Department to do a second review and then finalize the committee members that would sit on the steering committee. And so through that process, we were able to identify 17 members. that reflected a diverse group, and were also reflective of the population that is affected or living with HIV within the Los Angeles County region. And to date, we've held 16 meetings. Our first meeting was held October 2020. We have full committee meetings in addition to ad hoc small group meetings. And the topics range. At the beginning, we were meeting to discuss the development of the Ending the HIV Epidemic plan. We've had other meetings that focus solely on HIV testing, self-test kit distribution, rapid linkage to care, PrEP and teleprep strategies. We've also had meetings on cluster detection and meetings on certain pilot programs that we have launched or plan to launch that are included as part of our Ending the HIV Epidemic plan. So for example, we had the group weigh in on contingency management pilot program and other evidence-based interventions to really garner input on what made sense for us in our EHE work. In terms of the roles and responsibilities, our steering committee, of course, advises our Ending the HIV Epidemic efforts, our plan implementation on both the CDC EHE side as well as the HRSA EHE side. But in addition to advising our work at the Public Health Department, we really asked the committee to be action-oriented. So we put out the application and really emphasize the fact that we want our steering committee members to be catalysts for change. And so in addition to acting as an advisory group, they also implement an Ending the HIV Epidemic project of their choice. And so we've worked with committee members to think through what those projects look like, if they're related to a specific pillar under the Ending the HIV Epidemic initiative, whether it's diagnose, treat, respond, or prevent. We also asked committee members to conduct 5 cross-cutting Ending the HIV Epidemic activities per year, which can range from your general Ending the HIV Epidemic promotion, presentations, trainings, Ryan White service promotion, provider outreach, identifying key stakeholders or new partners to bring into the fold. And then in addition to that, we asked the committee members to share information on best practices, innovative HIV prevention and care strategies. We asked them to accelerate implementation of strategies within their own organizations and their networks and communities. They promote active exchange of information between stakeholders and among the committee members. And then that last box at the bottom there, we asked steering committee members to commit to serving a 12-month term, so requiring 4 to 6 full steering committee meetings per year, plus attendance of small group meetings based off of their interest. And so we're really grateful that we've had a strong group that is committed to the work and is open to really, again, serving as catalysts for change and implementing projects of their choice as well. And this is a snapshot of our current EHE steering committee. And we have a, again, diverse group of folks across sectors, from housing, harm reduction. We had Mayor Horvath on the committee, who is now council member of City of West Hollywood. We have federal qualified health center representation, community-based organization representation, community members, a member from the hospital community benefit program, mental health, and a few consultants as well. So again, if you're interested in learning more, their biographical sketches are available on our EHE website via that link below. And now it's my pleasure. We've invited 2 steering committee members, which Elena mentioned, and so I will pass it off to Matt Brush.
Thank you, Julie. Good morning, everyone. Great to be here. Thank you so much for having us. I just want to speak a little bit about my personal experience as a member of the EHE committee in Los Angeles. So I joined in the very beginning in 2020 after I had an experience of working as an outbreak investigator for LA County Department of Public Health. So I was sort of working headfirst into the beginnings of COVID investigation before we really knew what was going on. And had also done a lot of work previously to help address the needs of trans people who were seeking gender affirming care as well as HIV related care. So I kind of come to the committee with the perspective that we should think about hard to reach populations in a different way and think about how we can make services more accessible and easier to access for folks. Something else I wanted to highlight about the committee, as Julie mentioned, is that we all come from diverse backgrounds. We have people who run their own businesses. We have people who have served in public service positions, people from a variety of personal experiences, and many of us have actually worked at different organizations throughout the county. So we're familiar with each other's work in that way. The committee has also really offered a lot of unique speaking and knowledge sharing experiences for us. I think that many of us would not have known about because we sort of stay in our own siloed area. One example is I had the opportunity recently to speak at the UCLA Pathways program, which is a program that helps connect students who are interested in joining the public health field or the health field more broadly. Kind of told them a little bit about some of the things that we do at EHE and other initiatives within DPH. So again, I really just wanted to stress, like, I think this committee has, because of all those diverse experiences, the reach and advocacy that we're able to accomplish has really improved. And we've, through kind of dealing with some of these simultaneous co-occurring pandemics, we have been able to kind of plan ahead and take some time to reflect and instead of respond during this time as well, which has been really meaningful and helpful for us in terms of what comes next. Which may be unknown, but we are prepared. So I want to pass it along to Ty now, who's going to talk a little more also about his experience serving on the committee. Thank you so much.
Thank you so much, Matt. Again, great to be here with all of you. I am Ty Gaffney-Smith. I'm the outreach coordinator here at APLA Health. I have been an EHE steering committee member since the beginning. I was very excited to join the steering committee. Coming from a background of linkage to care services in LA, I've spearheaded several initiatives, one being Healthy Him, which is a holistic approach to men's health regardless of sexual health status. So coming on to the committee, it was great to be around a group of individuals who understand diversity, who understands that everyone's experience is valuable. Just like I said, coming from a linkage to care background, my primary concern and goal, I am literally focused on the treat pillar of our 4 pillars. My primary concern and goal is to make sure that people who are HIV positive have a voice in this space. We talk a lot about ending the epidemic, and we need to also highlight those that are living through it to make sure that we end it the correct way. So being in this space has been a privilege, to say the least. I've had several opportunities to speak with cohorts and groups of people just over what we're doing, all the amazing stuff that we're doing under Julie's leadership. And the team is very excited to continue to implement all of these strategies to make sure that we get to zero. I joined because here at APLA Health, I was in the process of figuring out what my next move was going to be after linkage to care. So when I became the outreach coordinator, this just made the most sense to me. It excited me as soon as I got the email that I was accepted. It was like getting a college acceptance all over again. So I was extremely excited about that. Some of the effective elements in the infrastructure as it relates to HIV or the EHE process, just being able to have conversations with individuals who are benefiting from these services and who are part of this. This is a community space that we are in, and we're going into communities and having conversations and getting people excited about what we are doing, one, but then also two, creating a table for people to sit at. Instead of inviting people to the table, letting the community create it themselves and then kind of just assist with the facilitation of it. So it's been a really great experience thus far. I'm really excited to be in my 2nd year with the EHE committee, and I don't plan on stopping anytime soon. Some of the successes and the lessons I've learned, personal lessons have been patience, being able to come up with a great idea and then have the patience to see it through. And also I've been supported very well throughout the process of this from APLA Health, the community, Julie and the team. Everyone has been extremely supportive in this space. So very excited for you all to see all of the things that we are working on. And that is it for me. I am very happy to be here with you all.
Thanks, Matt. Thanks, Ty. I appreciate you weighing in. And for all of the participants, if you have any questions, please add them into the chat and we're happy to answer, or during the panel in a few minutes. And so just to close out, some of the successes and lessons learned from the development of our steering committee is that we've really been fortunate to have committed committee members. And so as many of you are aware, Ending the HIV Epidemic launched right when the pandemic started. And so we really had to think through how we were going to meet with our committee members. We moved to virtual participation, which you'll see on the right there. Virtual participation and feedback can work. And we just appreciate our committee members and always being adaptable and flexible as we launched our Ending the HIV Epidemic efforts. Some other successes is that we were really able to garner new perspectives and insight into our HIV efforts. So many of you are aware, Los Angeles County is huge. There are so many existing and longstanding partners. So in addition to working with the Los Angeles County Commission on HIV, working with other community advisory boards that are already existing within the county, this committee we were able to bring in those new voices and expand our reach and amplify all of our efforts with the input that we received from this committee. And then I mentioned earlier, we were able to bring in some non-traditional HIV partners and some folks that represented different sectors of the public health arena to engage in our efforts. And so all of this has really led to our Ending the HIV Epidemic progress. Some of the projects that some of the committee members have really been instrumental in moving forward are related to the distribution of HIV self-test kits within their communities, organizations on Skid Row. We've been able to launch a countywide mental health assessment. We've been able to develop a harm reduction module at Cal State Long Beach. We were able to launch an U equals U, or undetectable equals untransmittable training for new housing partners. And again, we've really been able to bring in new partnerships thanks to the work of committee members. So with that, I will close and I will pass it off to Elena.
Great. Okay. Well, thank you so much, Julie, Matt, and Ty. Thank you for that great presentation. So now I'd like to invite all of our panelists to turn your cameras back on, and we'll move into some panel discussion and Q&A. All right. Perfect. So as usual, we'll begin with some panel discussion on a few of the topics that participants frequently asked about as part of registration, and then we'll move into some open Q&A. So for participants on the line, feel free to continue submitting any questions you have for our panelists in the Q&A box. But let's start with one of the key questions that came up during registration, which was, what are your strategies for recruiting and sustaining members? Each of you, I think, touched on this a little bit during your presentations, but maybe Ryan, starting with you, how does the ETE Coalition work to recruit and retain its membership base?
Sure. So I would say this is an area where we could use some improvements, certainly. I think, sometimes you just have to be really proactive in developing a recruitment strategy and bring in folks who are, this is happening in another coalition that I work on in the TB areas. You bring in people who are interested in being part of that strategy and, developing recruitment materials and tools. However, we do, we ask members to reach out to folks they know in their communities. Back when there used to be in-person meetings, that's coming back now. We ask people to have flyers and things like that describing the coalition. I've been doing I realized recently that in the last couple of years, I shouldn't be surprised, particularly through COVID, a lot of people have left their positions. And I thought that a lot of people were still engaged in the coalition who I never noticed. Their emails were bouncing through the listserv, and including members of the organizing committee. So I did the work to identify new staff and new leaders at those organizations and reach out to them, letting them know, your organization needs participate. We would love to have you. You bring a critical voice, some geographical, some community-based. I mean, we brought in some new numbers that way. In terms of sustaining, I think making sure you have a few things. One, don't make it too call heavy. Like we have our monthly coalition call, but we really try not to have working groups think automatically. We have to have monthly calls just now. People, everybody on this call, I'm sure, has fatigue around recurring monthly calls. We try to keep the listserv traffic really focused to the work we do, because we don't want to turn people off, and just really have meaningful ways for members to have input to the coalition and not just feel like, but actually, have a strong role in the coalition's development of priorities. So we have a once a year meeting. It's been virtual. We're probably going to have it in person this year, where we, get down to breakout groups and really hone in on what are the challenges you're finding in your organizations, your community. If you're living with HIV or hepatitis C, what are your challenges? That helps inform our policy priorities. So really making sure it's not just a few people making the decisions and informing, but making it a really grassroots coalition, I think is the number one way to sustain people and maintain membership.
Great, thank you so much, Brian. How about for you, Dr. Sammy, for East Bay Getting to Zero? What has your approach been in terms of kind of recruiting members and also sustaining membership?
Yeah, so I think that similarly, there's a lot of turnover, change in positions, and kind of natural fluctuations of folks who are members. So I think one of our strategies is just to have many levels of involvement. So we have kind of our big overarching listservs of, prevention interested folks and care interested folks. And there's like 200 plus members on those listservs. Our working groups are open to anybody who's interested and able to participate. And as much as it overlaps with their work and contributes to their work in their organization, we love and promote that. And then for our core team members, we've really worked hard to work with our fiscal sponsor to figure out ways to compensate people appropriately for their time as much as we can. So everything from kind of standard just reimbursement for transportation and things like that, all the way up to actual employment opportunities. So part-time employment for our folks who are serving as our working group facilitators, even though we only know it's going to be, a few hours a week or kind of fluctuating depending on the project, an opportunity for them to actually have some economic empowerment, build on their resume and really have it be a true job that they have as part of their work. And we just feel that that's been a really important part of asking for meaningful involvement from people who are most impacted by all of these epidemics, that we really have a way to compensate them for their expertise. And obviously with competing priorities, that's something that is really important to all of us and especially our most impacted members.
Thank you so much. I'm wondering for our LA County folks, maybe Julie, maybe you can touch a little bit more on, the recruitment and retention methods kind of from the administrative side. And I'm wondering for you, Ty and Matt, if you can speak to what, kind of what has motivated you to be retained as part of this great steering committee. So Julie, maybe over to you first, if you can talk a little bit about your retention approach.
Sure. I think in terms of recruitment, we've just been really fortunate. So I think the way the application was designed, we really were able to get really committed applicants that were invested in this work. And so we've been fortunate that a lot of the committee members have decided to continue from year 1 to year 2. In terms of retaining, we do have, our standing meetings, and then we do have the ad hoc meetings. And I think it's really just based off of our committee member interests. So again, we've been fortunate that we do have committee members that have specific areas of interest in terms of our Ending the HIV Epidemic work. And so we've always had good turnout for them to weigh in on specific strategies or implementation of programs that we're thinking through and designing.
Thank you. And so Ty, for you, can you share a little more about what has, you shared this a little bit during the presentation too, but what has made this a meaningful experience to you and what has made you want to stick with it?
I think for me specifically, I think that the intentional diversity was what caught me initially, just being able to come in with the experience that I did have, and be able to share my points and my opinions in those meetings, and then also be able to learn from community members and other people who are in the field. I think it goes a very long way when you have people who are on one side of service and then the other side of service come together and kind of have a conversation about how making those services can be better, right? So for me, it was the intentional diversity, just having a conversation with people who are benefiting from services at my job or wherever the case may be, and giving us feedback as well in the process of those meetings. I noticed that every time I go into one of those meetings, I learn something new. So that's what keeps me engaged for the most part. I mean, we have a really, really solid team of steering committee members. We keep in contact outside of the meetings. So it's really, really cool to kind of have this cohort of just like education from all different aspects.
I would echo a lot of what Ty said. For me, a lot of what has maintained my interest is that learning aspect. I think something that Julie has done a great job about is when the group expresses questions about something or wants to know a little bit more, she will offer to bring an expert in or someone who can kind of present their perspective or from their employment position a little more about how a particular thing functions. I'm thinking recently about how we recently had someone come speak about cluster detection and molecular surveillance in LA. So that was something a lot of people had questions about. So we went ahead and brought someone in. And then I find that these conversations just provide almost endless areas for growth and expansion. As I've worked in different areas within LA County, sort of as an LA County official, I've also seen working with community-based organizations on the other side of it, how we can improve county systems to make those things a little bit more accessible or the barriers a little bit lower. We've had some really unique opportunities to expand even into some COVID work. When I worked for the mobile vaccine unit for LA County, we worked on getting some leftover supplies turned over to harm reduction organizations. So anyone who had leftover needles and syringes, we were encouraging them to donate them to local businesses that would distribute them to people who needed them. So I think that these types of committees are going to continue to become important as we deal with the sort of simultaneous pandemics or issues that overlap in this way. And I think that innovation and those new ideas are going to be what really drives other initiatives like this and keeps people involved. That's why I stayed.
Great. Thank you all so much. I think this, Matt, what you just spoke about segues really well into another key question that came up during registration, which is how can community infrastructures help break down silos across sectors and support a holistic approach to ending the HIV epidemic? So maybe we can start with the LA County team this time. Julie, Ty, and Matt, what are your perspectives on this question of how community infrastructures like yours can help break down silos?
Sure, I can weigh in and then. I think the committee has been really helpful. So I mentioned during the presentation that we were able to get representation from across sectors within public health. And so I think that alone has really helped us tap into working directly with organizations or people that have experience working with people experiencing homelessness or substance use. We've been able to work directly with the Department of Mental Health and mental health providers. And so just speaking to the purpose of ending the HIV epidemic and really trying to break out of those silos, the steering committee has been instrumental in supporting that effort. One other thing that I'll mention is with the new group that we've been able to bring, they all have their own networks, whether it's in different sectors or different entities that they're connected to. For example, we have one member that sits on PACHA, and so we have a direct connection to PACHA and the conversations that are happening there. And so I think just being able to bring this group together has been really helpful in advancing our work.
Thank you. Ty and Matt, anything else to add?
I agree with Julie 100%. I can recall one meeting that we had where there was a lot of medical jargon being said. And one of our committee members from the community was like, hey, I'm sorry to interrupt this. I don't know what any of that means. Can someone break it down for me? And, you know, I'm sitting on the call in my office at APLA Health, and she had said it in a way where it was like, hey, I don't want to interrupt this meeting, but, you know, can someone explain to me what this means? And I just chimed in and I said, girl, I don't know what it means either. So it was easy to kind of just coming into this space, you know, be able to have conversations that like we can take out into the community and translate it in such a way where people are able to kind of like, one, understand it because that's important, and then two, understand their role in it, right? Like you're going to disseminate some of this information to your network, your friends, your staff, wherever it's going, right? So being all on the same accord with the steering committee has been like a highlight. And Julie does such a great job, like Matt mentioned earlier, explaining everything that we need to know, even if we have to come back to it. With a professional or whatever the case may be, so that we all leave those meetings with the idea that this is what our focus is, and we can take this and present this to our clients, we can take this and present this to our network. And it's just beneficial all around, just being able to kind of just express what you are interested in, one, but then also two, have those tools to kind of fully understand what the goal is to get to this zero number and to get to, you know, all of these people that we're trying to help linked into care and what that looks like, you know, and how we can support each other in that space. So breaking down those silos have been very important with us because we're all so diverse and we're all so different in such a sense. When we come together, those experiences making this one pot of just like motivation, it's really, really cool. It keeps me very, very excited for this.
Thank you so much, Ty. Dr. Sammy, how about for East Bay getting to zero? So the question again is, how can we ensure members of community infrastructures can help break down silos across sectors and support a holistic approach to ending the HIV epidemic?
Yeah, I think for us, the charge to break down silos really came early when we were doing our strategic planning and our listening sessions. And what we found was when we were coming up with our strategic priorities, it wasn't necessarily rapid ART and PrEP implementation. It was actually improving collaborations, being innovative, reaching youth. And so it became pretty clear that our job was going to kind of be to figure out how to bring new groups of people together. And so we really started using our natural meeting spaces to do that. So the traditional linkage and retention group, like I had shared, did that workshop that was specifically about emergency room linkages. So it was bringing in the director of the emergency department at our county emergency department and the team that was doing this really interesting HIV and Hep C screening program there with all of the HIV case managers, you know, and with people from the health department all in one space to really hear each other's perspectives on here's how our program works, what happens when the people get to your end of things, let's walk through a case example. Similarly with our youth work, we actually had an HIV prevention meeting that was just focused on bringing in community organizations locally who are experts in youth-centered work and how they're integrating HIV testing and prevention and how we can link young people to them. So we've really used our meeting spaces where people already come together looking for new information and ways to collaborate to kind of bring in those new partners. And then in our working groups, we can really think more creatively about how we use these partnerships to come up with cool new ideas and how we're talking to community members, how we're doing the work internal to our organizations. And it's been really fun, I think, for people to get to reach across those silos and know each other a little better. And it's turned into actually collaborative grant applications, which just further solidify. So it goes from kind of an informal relationship to, wow, there's this grant opportunity through the state. What if our three organizations came up with an MOU to actually solidify this into a real program? So that's been a really great benefit of it.
Thank you so much. And I'm really glad that you touched on the collaborative grant applications piece in particular. That's a question we've gotten in past learning collaborative sessions, kind of speaking to challenges with finding funding that can kind of support this cross-sector work and really support collaborative work that doesn't necessarily neatly fit into one category or box. So yeah, I'm glad that that you all at East Bay Getting to Zero have been able to leverage some opportunities to move in that direction. And would love to chat more with you about that so we can share that with our learning collaborative members. But Ryan, I also wanted to ask you for the ETE Coalition, again, this question about how can, or how is the ETE Coalition kind of working to help break down silos across sectors and support a holistic approach to ending the HIV epidemic? And maybe speaking again, I know you talked about the syndemics approach, but speaking maybe a little more to that would be helpful too.
Sure. So yes, as I mentioned in the presentation, I mean, ETE really came together around breaking down silos. I'm sure folks know, at one time there were, in California, there were HIV advocates, viral hepatitis advocates, STI advocates, harm reduction advocates. Of course, a lot of advocates fit into one or more of those categories. And each had sort of its different own coalitions, developing own budget requests and legislative requests, and meeting with state elected officials just to talk about HIV or just to talk about and really decided very early on in forming the coalition that it doesn't make a lot of sense. It's time to change that. That still happens a lot at the federal level, but time to be the model in California around breaking that down. So that was the original reason to decide to form a coalition that would address several of these epidemics together, and then recognizing that a big part of the approach is to address it to address the epidemics as a syndemic. Really making sure community and elected officials, legislators, their staff, administrative officials understand that that factors in hepatitis C, many of them are the same with, obviously, with harm reduction, HIV. That a community that's heavily impacted by overdose, many of those communities are heavily impacted by HIV, hepatitis C, STIs. And even with hepatitis B, there are a lot of new hepatitis B infections are among people who use drugs. So why not address hepatitis B and overdose and harm reduction together? So we think that sort of the work we're doing helps set a model of breaking down those silos. And we make sure that our talking points that are, letters to legislators with our budget priorities, we take the time to explain the syndemic every chance we have, because a lot of those folks don't know the word, or they've heard it, they don't really know what it means and how it connects to the work we do. So we just try to do a lot of education around it. It's why we have a slide for kind of every presentation.
Thank you so much, Ryan. I know we just have a little over 10 minutes left, and I want to make sure we get to some of these just open Q&A questions. So I'll go through some of the ones that have been submitted. If we don't get to your question, we'll be sure to follow up after the session. So feel free to continue submitting questions as you have them for anyone on the line. I'd like to start with a question for Dr. Sammy. The question is there a goal to integrate the care and prevention planning work going on in Alameda County? Can you comment on that at all?
Great question. I can't speak exactly for the county health department side of it. I know that has been a goal for a while, and I know that COVID and now MPOX are constantly kind of shifting attention to urgent clinical needs. But I think one thing that has been nice about East Bay Getting to Zero ending up being separate from the health department is that we do have the ability to respond in that way. And we definitely heard and understand that integration has to be the goal. And so we've been trying to take that approach more, and again, break down the care and prevention traditional boundaries and just really focus on a status neutral approach. So in our community community messaging campaigns, and how we're talking about innovative models, we always really start with that idea that we're approaching everyone. And then we're thinking about how do we quickly link folks to PrEP or rapid ART starts, or other sexual health services, and all the wraparound services that vulnerable folks need regardless of their status. So that's the approach that we're definitely trying to use at East Bay Getting to Zero for all the projects that we work on. And we've been allowed to plow forward with that, and hopefully be kind of a unifying force where our prevention and care partners can come to our steering committee and come to our groups and collaborate in this space, at least while they work out the more bureaucratic version of that part.
Great, thank you. This question is for Ryan. The question is, it can be a delicate posture to participate in the ETE coalition when 501c3 and governmental organizations can't lobby. So how is that managed within the coalition?
Sure, no, that's a great question. Since we do have a variety of partners and members and stakeholders in the coalition, the importance of recognizing limitations and boundaries is vital, and making sure that those are respected and understood by our coalition members. So, for example, governmental structures, Department of Public Health, for example, California Department of Public Health cannot engage in the type of lobbying and advocacy that a lot of folks in the coalition can do. That they would actually be kind of lobbying their own employer if they were to push forward a budget request. So in that case, we and so Kevin and others are on this call, Kevin Sitter, they're technical advisors for us. They provide a lot of technical support. They have information and access to data that we don't have. They understand, which agencies work on which programs and services. So they have that kind of role, and that helps inform our advocacy work. And that's completely appropriate. And we're lucky in California to have a lot of DPH leaders who participate with community in that way. As far as 501c3s, nonprofit organizations, there is some misunderstanding out there among a lot of folks around what organizations who are nonprofits can do. A lot of advocacy is really education and community engagement, and does not fit under the law as sort of like lobbying. Particularly if you're not taking a position on a piece of legislation, but you're just talking about the impact of regulations and lack of leadership and lack of funding on communities and addressing the epidemic. That's education and completely fine. And we try to educate coalition members around that. The only thing that coalition member or nonprofits really, the complete no-no is endorsing candidates. Like really can't get involved in partisan, but can take positions on ballot initiatives. So we really try to inform members and provide webinars and trainings so they really understand what can be done. But we also don't push. A lot of organizations really want to stay away from a lot of advocacy, and that's fine because they can help get information out to their networks. They can help let us know what the needs are in their local area. They can play such a vital role in the coalition just by providing that information. So there's a role for everyone in the coalition.
Great, thanks, Ryan. Julie, Ty, and Matt, we have a question here for you. The question is, the LA committee looks very professional. Is there also a consumer-specific committee or means for consumers to provide input? And combining this with another question, do you collaborate with any other kind of community bodies or coalitions to help ensure kind of unaffiliated community member input as well?
Sure. So our committee does have representation of consumers or people living with HIV. It was open to anybody to apply. In addition to that, to the second part of your question, we work closely with our longstanding partners, the Commission on HIV. They have a consumer caucus, and we've been working closely with the Youth CAP community advisory boards through our vulnerable population contracts. We've been working closely with the Connect to Protect LA coalition as well. And so, and even beyond working with those, existing structured committees and advisory boards, we're always open to feedback from the community and consumers. And so open to having conversations or setting up meetings, or if folks even just want to email us with suggestions and recommendations. We take everything to heart, and we discuss with our team, not only the steering committee, but with our Division of HIV and STD program team, to figure out how we can best implement and be responsive to community input.
Thank you, Julie. A similar question came in for you, Ryan. Does the ETE Coalition collaborate with any other coalitions or professional groups?
We do, and it's in our strategic plan to do more. A couple of examples is we've brought on coalitions that are working on legislation or budget requests that obviously impact the communities we are advocating on behalf of. Where there's a connection, we want to educate as many of our coalition members as possible. So we've had coalitions working on the Racial Justice Fund, the California Racial Justice Fund, to talk about what that funds pays for, I guess a better way to say it, as well as the budget request this year. And that helped educate our members, as well as ensure that the coalition signed on to support that budget request. And we've had presentations, and we're having another one in a month or two from coalitions working on abortion rights, reproductive rights, to really do the best we can to make sure all coalition members understand that the attacks on those rights has a strong impact on the work we're doing in the communities who are impacted by epidemics. And I'm sure we'll wind up being able to support in some way coalitions that are leading in that area. I know we want to do more of that type of partnership, but so it's about partnering and not figuring out how we can also lead in these areas. It's respecting the groups that are leading in other areas, figuring out how we can support and educate our members.
Thanks so much, Ryan. We have 3 minutes left, so I know we have just a couple more questions in the Q&A. We will be sure to follow up on those questions after the session. And again, if folks have even more questions, feel free to submit them quick to the Q&A before we close the call. I did just want to ask if any of our panelists had kind of any, a key recommendation or any final kind of words of wisdom you want to share with our participants who, might be considering forming a new community infrastructure to support their EHE work, or might have one, but it's kind of in development. Any words of wisdom or any kind of key final recommendations you'd like to share? Julie, I'll start with you.
I think the only thing that I'll share is that, in order to reach our goals for ending the HIV epidemic initiative, we need as many people involved as possible. And so I think there's value in creating these types of committees, whether, if they're new committees, expanding existing committees, people we've talked already about across sectors, people that might not even really be aware of what's going on with HIV and STDs currently. I think that just the more people that we can get involved, the better. And so I'm going to encourage everybody to think through how we could implement and expand our reach. And I'm happy to kind of meet or discuss with anybody that is interested in learning more about our process of how we created this committee. And then I'll defer to Ty and Matt for them to weigh in.
I agree 100% with Julie. And then also collaboration is very important. Be very intentional on collaborating with other committees and organizations so that we all share the same goal of getting to zero. So often when I first came into this field, it seemed like HIV was like a number. You were supposed to test as many people as possible, link as many people as possible into care. And there wasn't that human aspect to it, that community aspect to it. And I think that these committees kind of make up for that. Everybody's in it for the right reason, and we're all trying to collaborate together to get to a collaborative goal. So be open to collaboration, reach out, speak to whoever you see or anybody's information that you have on this chat, and ask us anything.
I would agree. I think just going ahead and exploring those routes that are new and exciting and that the community is excited about will provide us with lots of new avenues to reach people we hadn't reached before.
Thank you. Ryan, any final words you'd like to share?
Yeah, I mean, I would say no need to recreate the wheel. There are so many groups, including folks on this call who have great experience and have both successes and lessons learned to share. So no need to start from scratch. And I think just really understanding and respecting what everybody brings to the coalition and to the work. And understanding not everybody has the same interest or capacity or set of maybe leadership skills, but really understand, respect that, make sure everybody's honored in the coalition, but also provide opportunities for people to learn more or be supported in moving more into a leadership role if they choose.
Thanks, Ryan. Dr. Sammy, the final words with you. Any last words of wisdom?
I agree 100% with what everybody said. I don't really have much to add. Just reiterating the collaborative process. And I think really using those collaborations that you're able to build over time as a success in and of itself. So even if the projects don't go exactly how you want to, or the funding doesn't come in how you want to, building those relationships, I think we've seen has paid off in unexpected ways. And same with the collaborations in time. So I echo that earlier sentiment about patience with the process too, as we see all of these collaborations through.
Great. Thank you so much. I know we're unfortunately at the end of our call time today, so much more to talk about, but I do want to thank all of our panelists again for sharing your amazing work and your wonderful insights with all of us today, and also wanted to thank all of our participants for your great questions and participation. As usual, please look out for a follow-up email from me with relevant information from today's session and a link to our evaluation form. And the recordings and slides will be posted on our website by early next week. So thank you all again so much, and I hope you have a good rest of your day. Bye, everyone.
Thank you, everyone. Take care.